Just a couple of weeks ago, we adopted reforms that will use competitive bidding and market forces to allocate more than $2 billion over the next decade to spur broadband expansion in areas that are so high cost to deliver to that we need to explore new and innovative ways of getting there. So we put up $2 billion to get to those areas. We're also working hard to make sure that E-rate funding for broadband connections is getting out in the right way to rural schools and libraries and to promote rural healthcare connectivity in rural America. Let me give you a couple examples on that. This year we will send $435,000 to the Pike County School District so they can connect every school with fiber, with high-speed fiber, so that our kids can have the kind of connectivity that we're all talking about here. We'll send $110,000 to the Pikeville Independent Schools. We spent $55,000 to the Pikeville Library. And in case anybody is interested in the broad 5th Congressional District, I don't know who that might be, Congressman, but we'll send $13 million to the 5th Congressional District this year and every year to make sure that the students in the 5th Congressional District are connected to the outside world, because that's what prepares them for the kind of jobs that are made available by this broader broadband connectivity that we're talking about. And that's something that you and I all make possible by our small monthly contribution. So we're doing everything that we can to make sure that the money is well spent to deliver universal broadband connectivity. And I'm working with Chairman Rogers to see to it that the FCC oversight of universal service doesn't have to compete for resources with everything else that the Commission does. And we can specifically identify funds that make sure that there will always be the oversight necessary to make sure that these kinds of resources are coming to rural America. So let me just close with two things. One, the governor talked about enthusiasm. I have a little paperweight on my desk that my wife gave me for Christmas with that exact quote. Nothing worthwhile has ever been accomplished without enthusiasm. There is a need to be enthusiastic about the promise that broadband brings to all America. And there is a reason to be enthusiastic. And that reason has been proven right here in Jackson County, right here in Pikeville with what BitSource is doing. And we all can be grateful. You all can be grateful that you have representing you in the United States Congress a man who feels that enthusiasm and has that vision that has resulted in SOAR and resulted in the kinds of things that collectively we can all do to build the high-speed future. Thank you very much.
Y'all look excited? Oh, we're supposed to have a break right now. We're going to do one more speaker. We're going to do Dr. Frieden, and then we are going to take a break. I said we might plow through it. Do you need a break? Are you good? Are you good to go? You want to keep going through? You want like a 5-minute break after Dr. Frieden? This is a powerful comments here, and we are honored to have several of our presenting partners represented to help introduce the CDC and Dr. Frieden and his keynote comments today. So I'm going to ask them to come on up. First is Kathy Stumbo, University of Louisville and Kentucky One Health.
Good morning. It is my honor and privilege to be participating in the program today. This is a program that's so important to the future of Appalachia. This is my home. I'm from Floyd County. I am the president of St. Joseph Martin Hospital in Floyd County. And today I'm here on behalf of Kentucky One Health. We are the largest health system in the Commonwealth. And in partnership with the University of Louisville, we serve as one of the corporate sponsors of the SOAR initiative. You know, our Appalachian region has experienced disruption and change from an economic perspective over the past several years. And healthcare as an industry has experienced a very similar disruption and change. And in fact, the United States is facing a healthcare crisis of unprecedented proportions in recent years. The rising cost of care, an aging population, the increase in chronic health conditions like diabetes and heart disease, all of these are challenges that we're facing in our healthcare industry. And in addition to that, in recent years, prescription drug abuse has become a great challenge that we're all concerned about that is ravaging our families and our communities. Yet, I believe that all of our SOAR corporate partners who are involved in this initiative believe that we can overcome these adversities. And the way to overcome them is really through innovation and collaboration. And so the whole purpose of our summit today is to discuss innovation. You know, when you look at our corporate partners and the list of partners, the number of those that are involved in the healthcare industry is long. And I think that is because we have a commitment to the communities we serve and to building the health and well-being of those we serve. Disruption and challenge necessitate change and innovative thinking. So we are especially proud to have so many innovators from throughout our region here today. And as you visit the tables and you visit the exhibits, you're going to see a lot of innovative thinking that is going to help to shape our Appalachian region in the future. And some of those are dedicated to healthy communities. I know at Kentucky One Health we have an exhibit here today. Hope you have time to visit that. And we are trying to be innovative and focus on promoting healthy living and lifestyles in non-traditional ways. Let's face it, if you look at the statistics in healthcare, we've not always been very successful with focusing on those very traditional ways of delivering care. So what we're trying to do is get outside the four walls of our hospitals and our healthcare facilities and get involved in our community where our community needs us. And some of the things that we're doing with Kentucky One Health is we are sponsoring violence prevention initiatives in all the communities we serve. You know, we need a violence-free community in order for a community to thrive. This past year, we have opened 2 healthy lifestyle centers in some of our larger markets. And we also have a new program that is called our Anywhere Care program, which offers 24-hour-a-day, 7-day-a-week, internet-based access to medical care. If you have a chance to visit our exhibit, you're going to hear about our telehealth services. And we are also offering lots of services within our communities, such as our Walk with a Doc program. So we are trying to be innovative because our purpose is to bring health, wellness, healing, and hope to all we serve, including the underserved. And so that is why we see this initiative, the SOAR initiative, is so very important to support, and that's why we've joined the University of Louisville as sponsors of the initiative. So today I am pleased to open up this discussion of healthcare and healthy communities and to be part of the corporate sponsors that are welcoming Dr. Frieden. and we applaud his dedication to Eastern Kentucky and his continued work to improve the health of our nation as a whole.
Good morning. I am Donna Arnett, the Dean of the College of Public Health, and I am here on behalf of the University of Kentucky and UK Healthcare. I was born in London, Kentucky. As Congressman Rogers knows, there has been a brain drain out of Eastern Kentucky. I'm one that's come back after serving as president of the American Heart Association and former chair of epidemiology at the University of Alabama at Birmingham. But I get the wonderful opportunity to introduce Dr. Tom Frieden. He is the director of the Centers for Disease Control and Prevention since 2009. And prior to that, from 2002 to 2009, he was the director of health for New York City. Now, Dr. Frieden is one of these leaders that doesn't just look at a problem and say, this problem is too big for us to solve. He's one of those leaders that says, let's solve big problems, and really goes after them in a big way. He started the Million Hearts campaign while I was president of the American Heart Association, a campaign to reduce deaths from heart disease and stroke by 1 million by the year 2015. He also reduced multi-drug resistance tuberculosis by 90% during his term as New York City Health Director, and he cut teen smoking rates by half. He has been very instrumental in helping bring to Eastern Appalachia the focus on prescription drug abuse and overuse. And I'm proud to say that his first job 30 years ago was right here in Appalachia. Without further ado, Dr. Tom Frieden.
Good morning, everybody. It's great to be back here, and thanks so much to Congressman Rogers, to Governor Bevin, to Jared, and to everyone who is working to shape and reshape this fantastic region. It's great to be here, and I do want to just spend a minute saying that I'd like to tell you what we do at CDC. At CDC, we work 24/7 to keep people safe and secure. And that means fighting threats wherever they emerge, whether in this country or around the world, whether they're naturally occurring or man-made, whether they're from infectious diseases or other causes. And right now we're pretty busy, as Chairman Rogers said, with Zika, which is completely unprecedented. Never before have we identified a situation where a mosquito bite could result in a devastating fetal malformation. And we are working around the clock to try to protect pregnant women. That's the bottom line here. And some of those challenges are in this country, including in Puerto Rico, some of them around the world. I will never forget the trip I made a couple of months ago to Puerto Rico to talk with people there. We had heard a rumor that people weren't taking Zika very seriously, so we had a number of focus groups with women in local communities, pregnant women. We asked them, are you concerned about Zika? And the woman sitting right next to me in an old t-shirt from a very poor community said, of course I'm concerned. If my baby has a birth defect and can't take care of himself, the rest of my life will be taking care of him. And when I die, I'll be worried about who's going to take care of him. So I remember that all the time, because what we try to do in public health is remember the faces and the lives behind the numbers. I'll give you a lot of numbers, but the bottom line really is it's about lives, it's about people, it's about communities. And innovation, the theme of your conference, is a core part of that. And at CDC, we do a lot on innovation. In fact, even for the Zika response, we have invented the laboratory tests that are being used now in 100 labs around the US and nearly 100 labs in 100 countries around the world. We've produced in our laboratories 1 million of those tests and distributed them. We've figured out how to make them more accurate and quicker, and we're trying to make them even more accurate and even quicker. So innovation is really important. Now, when it comes to improving health, I wanted to speak a little bit about, you'll hear from John Auerbach later, who's our policy director at CDC, the concept of 3 buckets of health. I think when it comes to health, there are certain things that are really important that we all keep foremost in our mind. health is integral to society. It's integral to productivity. It's integral to being able to be economically viable, economically productive. It's integral to having a successful educational system. So health is fundamental, but health also relies on all of those things. And we think of the three areas where health can be improved. One of them is in actually health care facilities. Health is more than health care, and health care is more than hospitals. But that first bucket is, how do you get the most health out of your health care system? And I have to tell you, in much of our world, optimizing or maximizing health isn't the organizing principle of our healthcare system. There are lots of other organizing principles, but asking the simple question, how can we save the most lives? How can we make improvement of health as great as possible, doesn't always figure as the key variable. So that's the first area where we can make a big difference, and I'll talk about some of the areas within that. The second bucket, if you will, or area, is the intersection between the community and health, where you might be able to have community health workers make a really big difference. I'll talk about the Diabetes Prevention Program, an exciting program that has a lot of potential, and programs like Kentucky Home Place are exactly the type of program that are needed, which can be wins for everyone. They're wins for employment because it's good jobs. They're wins for the healthcare system because it reduces healthcare costs. They're wins for the patients because you have a closer to client initiative, and they're wins for quality because often when you have a system where different levels of health workers are working in coordination according to standard policies, agreed policies determined openly, you get better quality. And the third bucket are changes in society as a whole. And what you are doing to create jobs is crucially important. There is a very tight correlation between ill health and poverty. And the more we can improve economic opportunity, the more we can promote economic vibrancy, the healthier people will be. But that doesn't mean we should be hopeless. There are things that we can do. We don't have to wait for prosperity to be healthy. There are things that we can do, and in that third area are changes in society as a whole that have massive influences on health. Think of the last 100 years, fluoridation of water. That has made an enormous difference in oral health, or having availability of healthy places to be physically active. That's very important. Smoke-free workplaces. Let's be clear. Nobody should have to risk getting cancer to come to their job. And places in the country that have gone smoke-free have found that it hasn't hurt business, and it's saved a lot of lives. Now, I want to start with the issue. I'm going to just talk about a few examples. When asked to speak at an innovation summit, I thought, let me talk about the things that have been successful innovations from communities around the U.S. Because one of the roles of the federal government is to enable one part of the country to learn from another. That's one reason what's happening in SOAR is so important. Because what you do successfully here isn't just going to help people here, it will help people around the country and around the world. But what I'd like to do is give you 6 examples of communities that have innovated and had big successes. And you can decide that's relevant to us, that's not relevant to us. That's your decision. Our role is just to tell you what the evidence shows. We're very much into evidence, and we're very much into outcomes. You heard earlier from Professor Gallardo the question, so what about the digital divide? Well, I really like that so what question. That is a very common question we ask at CDC, at the Centers for Disease Control and Prevention. And we don't ask it to be rude. We ask it because we care about the bottom line. So what means, what difference did it really make? We know that old saying is true, that the road to hell is paved with good intentions. It's not enough to have good intentions. It's not enough to do programs that make us feel good that we're making a difference. We want to actually know if our programs made a difference. That's what really matters. So I start with what makes the most difference, and it has to do with our hearts, with cardiovascular disease. That is the leading cause of death in this country. It's the leading cause of health inequalities in this country, and it's the most preventable major cause of death. So we are not preventing a lot of heart attacks and strokes. That means more disability. That means fewer people who can be productive in the workplace. That means more time off from work, either caring for someone who's ill or being ill yourself. So heart disease and stroke are really important. And what this shows, that if you can't see it, that's okay. It just shows that in many parts of the country, a large proportion of the population has a heart age that's at least 5 years older than their chronological age. So this was a calculation that CDC did that basically showed that our health is being undermined by many things, and heart age can be tracked. Now, what I'd like to mention is one community, urban and rural, in Minnesota. And they got together in the 1990s, and they said, we're going to do something about it. And what they did was got all of the healthcare providers and all of the insurers together. They agreed on protocols, they agreed on reporting, they trained everyone, and they said, we can make a difference here. And they got blood pressure control, which had been no higher than the national average. They got it way higher than the national average. The country and Minnesota started at the same point, and over a period of just about 10 years, Minnesota went up to 70% from 34% or so, 32%, and the US went to 50%. So everyone got better, but Minnesota got way better. And it did that by finding more people who weren't on treatment and by treating people more effectively. And I want to shout out to the Grace Community Health Centers, Mountain Comprehensive Health Corporation, and Sterling Health Solutions. We've been working with you, and Grace Community Health Center in particular increased their blood pressure control rate from 53% to 71% in just a few months. So congratulations to you. Don't we have a hand for them? That's exactly the kind of program that can make a really big difference. A few years ago, colleagues and I asked the simple question, how can you save the most lives through healthcare? And the answer is very simple: control blood pressure better. It's the single thing that can make the biggest difference. So we want to see that everywhere. And there's no reason it can't be done. The medicines are inexpensive. They're once a day. There are plenty of medicines that don't have any bad effects on you. And the payoff is real in terms of reduced heart attacks, reduced stroke, less kidney failure, less other problems. High blood pressure is tough because it's been called the silent killer. You can't feel when it's up. So you need to have systems in place to support patients to get it controlled. Second example, smoking. I have to cover it. I know it's controversial, but you know, if I didn't, it would be dereliction of duty as a public health doctor. Smoking rates are 3 times higher in some states than others, and it remains the leading preventable cause of death in this country, with 480,000 deaths a year. Now, in New York City, where I was lucky to be health commissioner for 7 or 8 years, we were able to reduce teen smoking by more than half, from 17.5% to 7%. It's even lower now. 7% of our kids, 5% of our kids smoke now. That's a really low number for high school, and adult smoking down to 14%. So a big decrease that will save 100,000 lives. You can do that with smoke-free laws, with hard-hitting ads to inform people what really happens. We've run the Tips from Former Smokers campaign. That's been supported by Congress. That is just real Americans telling their stories about what smoking did for them. Each of those heroes, 31 of them, have come forward, real Americans, to tell what smoking did for them. Each of them will probably, through their testimony, save more lives than most doctors will in their whole career. And that same kind of testimony we think will be effective for helping people understand the problems with opiate addiction and opiate abuse. And that kind of hard-hitting, real-life story is something that Operation Unite is doing, that we're supporting, and then we're thinking about other ways to get that message out more broadly. So that's a winnable battle. You can make a difference. Now, obesity. You've chosen obesity as one of your 3 areas to focus on. Not an easy area to focus on, I have to be honest. There aren't a lot of success stories where communities have been able to reduce their obesity rate, but I'll give you one. Somerville, Massachusetts. They had a 21% decrease in obesity in kids under 6. What did they do? Many different things, not one magic bullet. They were the first community to actually show this, and they improved physical activity and nutrition in schools and childcare. I see you have some school physical activity programs here. I urge you all to look at physical activity in daycares and schools. It's really important. If kids are not bouncing up and down in the gymnasium, they're going to be bouncing off the walls in the classroom. every school can at least improve the quality of physical education. There's a fight over time. How much time can they get in PE class? We've looked at this nationally. How much time that the kid is in PE class are they actually physically active? Less than a third. Get them moving from the second they move in to the second they get out. And then try to increase that time, because there's pretty good evidence that kids who have more physical education do better in school. Physical education is the closest thing we've got to a wonder drug. I'll get back to that in a second. But they also increased physical activity and nutrition community-wide, with farmers markets, with farm-to-school programs, with local produce and more. They implemented walking paths and planning and public transport, ways to get people so that it's easier to do the healthy thing. And there was a lot of focus and mobilization with the mayor of the town leading walks and focusing and making it fun for people. And that's something that every community can do. So obesity prevention and success, physical activity is in fact the closest thing we've got to a wonder drug. It can control your weight, but even if you don't lose 1 ounce, being physically active will reduce your risk of a heart attack and stroke, reduce your risk of diabetes and cancer, strengthen your bones and your muscles, improve your mood and your mental health, improve your activity to do your daily activities and to live independently and prevent falls, and increase your chances of living longer. And it doesn't have to cost a cent. Maybe you have to get a new pair of shoes a little sooner if you walk more. But other than that, it doesn't have to cost anything. Now, I want to mention the diabetes prevention program, and I'm mentioning in these programs in rural areas. We work with urban areas, we work with rural areas. We're privileged to work anywhere we see a potential and a need to improve health at CDC. This is the Nebraska Panhandle. They expanded their diabetes prevention program. Their participants lost an average of 6% of their body weight. 8 district clinics have systems in place to refer patients. This is a national program that's growing with recognition of diabetes prevention programs by CDC. CMS has now announced that they plan to have this under Medicare. Some Medicaid programs are looking at it, and this is a way of preventing diabetes. A patient with diabetes is going to live with that, with challenges, but for someone with pre-diabetes or early onset diabetes, we can often reverse the process. And that can be done through structured programs that can be done in communities. And this is, again, like your program of Kentucky Home Place, this is a program that employs people from within the community, makes them part of the healthcare system, and is a real win. Next example I want to give is cancer screening. And colorectal cancer is a leading preventable cause of death. About 90% of people who get screened early can survive their colon cancer. They'll live 5 years or more, but about 1 in 3 people are not getting screened promptly. There's a lot that can be done. If you go down that list of how do we save the most lives through healthcare, colon cancer goes pretty close to the top. And there are lots of ways to do it that will be supportive of individuals. And one example from around the country, rural area, is northern New Hampshire, where they used patient navigators to increase colonoscopy screening rates. This was really important. This showed that you could actually make a really big difference. And in doing that, you could not only decrease the number of cancers, but have more employment and more good jobs in the healthcare system. That means sometimes addressing scope of practice or ensuring that people are practicing at the top of their license, or people are working well as a team, doing what we call task sharing, so people are working together, but it works. The next example I want to talk about is teen pregnancy. Teen pregnancy is an area we think about a lot at CDC because we want to empower individuals and families. And we know that for too many families, teen pregnancy perpetuates a cycle of poverty. And for that, we have been promoting a comprehensive program that tells teens to wait, but also accepts reality that some aren't. And so we need ways to prevent teen pregnancy in all situations. We've seen a lot of progress. In fact, if you look down to 2015, we're down to 22.3 per thousand from 48 just a few years ago. So we've had almost a 50% drop in teen pregnancy over a 15-year period, 16-year period in the U.S. That's good. That's progress. And that means we'll have fewer problems with poverty in the next generation. That's important. That means that every child who is born has more opportunity to reach their full potential. But there are still big differences from community to community, and some communities have had decreases that are not as rapid as others, and that includes some of the communities here in Kentucky. But again, rural area, successful example, Spartanburg, South Carolina. And around there, multiple clinics, multiple approaches, supporting communities, supporting kids, supporting families. They were able to decrease teen births by 61% in that same time period, so faster than the national average. And if you look at Spartanburg itself, they had a 50% decrease in just 5 years. It's possible to make rapid progress here through changes in how Medicaid reimburses, through changes in how school health programs are delivered, through changes in promoting healthier behaviors in kids. So these are just innovative examples to think about where you might be able to make a big difference here. I wanted to bring those from around the world, around the country, mention that it can be small. We talked about healthy food, healthy water. I wanted to tell you one thing we did in New York City that I was really proud of. It was really simple. It turned out that we did some focus groups, and kids in New York City didn't think you could drink water from the tap. They thought somehow it was unhealthy, and you had to drink it from the bottle. And I don't have anything against bottled water. I'm just saying it was not something that they understood. So what we did in the schools, we put in the jet, well, not water jets, but you see juices and all in the square plastic thing that bubbles around. We put cool, cold water in there, and we put it at the front of the cafeteria line. And we saw huge increases in the amount of water consumed and no decrease in the amount of milk consumed, and an improvement in nutrition and an improvement in the kids' health and a decrease in their weight. So real success stories from simple things that can be done, because the big picture is that small interventions can make a big difference. If we were able to address cardiovascular disease, we could see a multi-year increase in life expectancy. Cancer, multi-year increase in life expectancy. Injuries, including poisoning, multi-year increase in life expectancy. And if you think about this, we produced this a couple years ago for part of eastern Kentucky, for the Kentucky Fifth. What proportion of the deaths from heart disease and stroke could be prevented if we just did as well as the best states do? And it's a lot. We're talking about over 1,000 deaths a year that don't have to happen if we had as effective a system as in the best places. And there's no reason this community could not. You've got the same or more community strengths. You've got the same or more resilience. You've got the same or more capacities here. So our role is to be with you, support you, be part of it. And the last example I want to give before stopping and allowing you to get to break is from Hernando, Mississippi. Blue Cross Blue Shield Foundation of Mississippi did a competition a few years ago, and they said, we're going to give a $50,000 prize and a year of bragging rights to the healthiest hometown in Mississippi. And they made it tough. They did things that we at the federal government would never do as a condition of a grant. And in order to win that, Hernando had to submit actual documentation of what they had done. They had to submit that they had made a complete streets policy, which means you can walk and bike on them, and then they had to build those streets and take a picture of one of them and send it in. They had to prove that they had expanded sidewalks and bike lanes and take a picture. That they had upgraded some of the walking paths in their community and take a picture. That they had passed a no smoking ordinance so that they'd protect workers from secondhand smoke. That they had helmet use for children riding on bicycles. That they had school wellness policies and a weekly farmers market. And Hernando won that. They won that, they bragged, they got the $50,000, they matched it with private dollars. They rehabilitated the track in their high school, and they opened it to the whole community. There was a walking group for seniors there at 6 in the morning. There were programs for after school. There were programs for evening. And all of that made the community more vibrant. And in the next year, for the first time in 40 years, a new business came to Hernando and opened up, creating new good jobs because they knew that it was a healthy place to be. And that's the thought that I want to leave you with. Health is not just about health, it's about the society. And there is an interplay. Healthier societies are more productive societies are more healthy, and by working together, we can ensure not just a healthier, not just a more productive, but a more vibrant, a more creative, and a society in Eastern Kentucky that's not only benefiting the society here, but that's benefiting the country and the world. Thank you all very much.
Thank you, Dr. Frieden. We are going to take a quick 5-minute break. I know we're behind, but I think people need to stretch their legs. We've got exciting presentations going into lunch of local innovators, local booths. They're going to tell their story of what they're doing. We got videos, we got a song, and I'm going to ask you, when we come back in 5 minutes, let me see what time that is. 11:40. When we come back at 11:40, if you wouldn't mind to come in here and not visit the booths until this afternoon. We've got all kinds of time built in this afternoon to visit the booths. Take 5 minutes. We're going to have some house music, and we'll be right back in here at 11:40 to see some great local community projects. I promise, 5 minutes. Thank you.
Toyota style. Hey, save some money. What? Walters Toyota style. Hey, save some money. What? Walters Toyota style.
Choose from 24 brand new Tacomas, Tundras, Highlanders, and 4Runners. Available right now at Walters Toyota.
Walters Toyota style.
Next Monday,
No running in the Capitol, man? No fast walking either?
politics as usual takes an extraordinary twist.
Something happened to my husband, and I need your help finding out what.
If I were you, I'd run.
From the creators of The Good Wife.
This is constituent care, not Nancy Drew.
You're outnumbered. By who? By the people you're outnumbered by.
Brain Dead premieres CBS next Monday.
God, I hate politics.
Here's a look at your community calendar. Send your calendar events at least 2 weeks in advance to WYMT TV, Post Office Box 1299, Hazard, Kentucky 41702, or email events to calendar@wymt.com.
Hi, I'm Susanna Sizemore with Moms Every Day, inviting you to check out our all-new momseveryday.com website. More content that can make your life easier, updated every day. Now you can take Moms Every Day with you everywhere on your desktop, tablet, and your smartphone. All the important information you need to meet your family's needs from local experts you trust. When you need it, where you need it. From your friends at the all-new momseveryday.com, making mom's life easier.
Walters Toyota style. Hey, save some money. Walters Toyota style. Hey, save some money. Walters Toyota style.
Choose from 24 brand new Tacomas, Tundras, Highlanders, and 4Runners. Available right now at Walters Toyota.
Walters Toyota style.
Follow WIMT on Twitter for the latest news, weather, and sports.
Hello, I'm Alan Gillen, CEO of Appalachian Wireless. I represent the 165 employees of Appalachian Wireless who live here and provide services to our people in East Kentucky. Today we partner with WIMT to bring you this historic SOAR event, building a new future for East Kentucky.
Appalachian Wireless, supporting our region now and in the future. Now let's join the SOAR Summit at the Eastern Kentucky Expo Center in Pikeville.
All right, 1 minute. We got 1 more minute. Come back and find your seats, please. We're going to get back. We're going to start it back. We really got some exciting things coming up right now. Some local projects. We're going to talk about innovation in land use. We're going to talk about innovation in building a technology workforce. Okay. Somebody be a leader and take a seat. We're going to give everybody a minute to get back in and gather back around. Have you guys... Has anybody here ever had to wait about 30 or 40 minutes to eat lunch when you thought you were going to be eating lunch? So... we've got lunch, I promise, pulled pork barbecue, and you're going to get to eat. But I'm going to ask you to respectfully bear with us as we finish out this morning. We've got some exciting things that are coming up in the next hour, and we will get you to lunch, I promise. The breakouts we will do on time this afternoon, and you'll have time to network. So come back in and find your seats, please. Our next speaker, as we have Congressman Rogers has worked with closely, and we worked with closely, and several other partners. I want him to share his story real quick about his presence here in Eastern Kentucky in the Moorhead area, and his commitment to innovation in his company, but it's industrial recruitment, it's industrial development in our region, an outside-the-box industry. Absolutely. So we're honored to have him here, Chairman and CEO of Radiant Corporation, Bob Skina.
Thanks, Jared. Thank you, everybody. I'm trying to, Jared, we've been working back here to kind of manage the schedule today, and I'm just wondering what message he's sending me right now, because I have the coveted spot right before lunch. Does that mean he expects me to bomb and it doesn't matter anyway, or does that mean he expects me to be good and maybe pull people back in? So I guess we'll have to see. First off, thanks for inviting me. I'm a recent addition to the schedule. Many of you know Chairman Rogers, who's down here in the front row, and he's a somewhat persuasive man. So last Thursday, I had the pleasure of spending some time with him, and he looked across at me and he said, "You know, Bob, I have an idea that you should speak at our SOAR Summit on Monday." And he said, "What do you think of that idea?" And I said, "Mr. Chairman, that's a great idea." So he did persuade me to come here. I'm the CEO of a company called Radiant Corporation. And we're from Pennsylvania, and a lot of people ask me continuously, why Eastern Kentucky and why Moorhead? And there's a little bit of a story to that, but I wanted to give you my headline on this is I listened to everyone speak, and of course it's technology focused, this event. And technology matters, and it matters a lot. But it's occurred to me as I've experienced life in Eastern Kentucky over the last year that while technology matters, people matter more. And it's really the people that I and my company, Ragent, have dealt with over the last year and a half. That's why we're in Eastern Kentucky. This began through a contact. You know, they say, does networking work? Well, Chairman Rogers was elected in 1980, and one of his helpmates and mentors was a congressman by the name of Bud Schuster. And Bud's son, Bob Schuster, is a lawyer for my company. So when I was discussing expanding a year and a half ago with Bob Schuster, he said to me, have you ever considered expanding to Eastern Kentucky? And I said, why no? I've never considered it. He said, well, you should consider it. And I have a good friend in Chairman Rogers, so he introduced me to Chairman Rogers' chief of staff at the time, who introduced me to a fellow by the name of Brett Travers, who does economic development in the eastern part of the state. He's right up here in the second row. And Brett met me at the airport. And you would have thought I'd known Brett for 40-some years. He just welcomed me, and he took me on a brief 6-week tour of the district, and he was really great. And everywhere we went, people welcomed me. Now, I don't think I have an accent, but I've learned as I spend time in Eastern Kentucky that I do. I'm from Jersey City, New Jersey, with a weird kind of New York, Philly metro blend. And as I went all around the district, obviously not from Kentucky, people were great to me. They welcomed me like family from that first day, and it really hasn't changed. So Brett wheels me up to Morehead State University, and he says they have a space and science center there. And so we walk in, and one of the professors, Jeff Kruth, and I think Ben Malfris, they come to greet me. And they said, you are the answer to our dreams. And I thought, wow, what do they eat late at night? This is really scary. But they were great. They showed me the Space and Science Center, and it turns out the kids at Morehead State are hand-building satellites called CubeSats. And these satellites have found their way into space. So kids at Morehead State, hand-building, fabricating, building the computers, writing the software, satellites are ending up in space, and I was really impressed. So ultimately, we ended up partnering with Morehead. We released space right down the street in Morehead, a 10,000 square foot facility. We're building it out, should be finished in July. I've transferred 3 Ragent employees to Morehead. They did not fuss. They're actually quite happy. We hired a fellow from Lexington. He's going to work out of the Morehead office. And a few weeks ago, we brought 6 interns from Morehead State, from the Space and Science program, up to our office in Malvern, Pennsylvania. They're all engineers, and they are all currently working. They work 90 days in the Philly suburbs, and they're going to come back here and be our first local employees. So we'll be at 10 employees by the end of August. I think, Tim, keep going. Keep going. Keep going. Right there, in this picture here. This picture here, now, just to give you a little background, we're in the commercial business. We sell hardened wireless radios to the U.S. military, the mining industry. We're in 6 continents, mines all around the world, the largest, most complex mines, oil and gas all around the world. But like everyone else, we're having to change with the times, and our most recent customer is a wonderful customer, but demanding like most customers, maybe a touch more. It's the National Football League. And so up on the right there, the fellows from Kentucky arrived in our office last Monday. The NFL, we had a test scheduled for the National Football League. How many of you are familiar with their coach-to-coach communications problem? The coaches, there's a bit of a struggle there. There's a question whether somebody could listen in to somebody else's communications. So it's a fairly serious issue. Using Chairman Wheeler's innovation band at 3.6 gigahertz, Ragent developed a radio that the NFL will have on the sidelines. Every coach will be wearing in the 2016 season. But it was kind of all dependent upon a test last week in Dallas Stadium. And what made it possible for us to succeed, I know this sounds crazy, but those 6 kids from Moorhead know how to build things. So we had an emergency assembly line, and that's them on the right, hand building the 12 radios needed for the test down in Dallas. And out of the 12, now you have to remember, they were at Ragent for one day. They got there Monday. Tuesday, we said, fellas, we got a bit of an assignment. And they took right to it. They built 12 radios. All 12 radios worked. And we got a pass on the test. And we're proceeding to build the radios for the upcoming season. So the Moorhead kids, they made a difference. They made a difference. So remember what I said, technology matters, people matter more. These kids had the right attitude, they're very smart, and they jumped right in. Now in the picture to the left, as I said, you know, our radios traditionally go on mining vehicles. As we all know, that's a bit of a tough market. So we're trying to move our wireless technology onto other things. You've all heard of drones. So on the left is a drone where we're installing our radios, and in the next 2 weeks we will have a swarm of drones flying. Most people fly them one at a time. We will fly them in formation. The first test will involve 3 or 4, but we expect 50 to 100 drones flying with nobody telling them what to do in this calendar year. And the Moorhead kids on the left are doing the software install on the drones to make sure we can get our test work done by next week. So in the space of a week and a half, these kids drove up from Kentucky, from eastern Kentucky, to Westchester, Pennsylvania, and have thrown themselves into a project for the National Football League and a project to create drone swarms. And drone swarms, what can they be used for? What will they be used for? Monitoring pipelines, power lines, rail lines. They'll be flying in formation along hundreds of miles of track and pipeline, and they'll be carrying thermal sensors and video sensors and chemical sensors, and they'll be monitoring for track and pipeline failures before a disaster happens. So that's the type of things these kids are working on. So it's really been a lot of fun. I don't know how many of you know, but Moorhead last year won an award, a grant in conjunction with Lockheed Martin to put a Moorhead State student-built satellite on the moon by 2018. So they're really sharp, and that's representative of what's possible in this region. So for Ragent, it's already paying off, but again, why did we commit? Yes, it was Chairman Rogers and Brett Travers, but the mayor, Jim Tom Trent, he's around here somewhere. He simply doesn't fail to help. Whatever needs to be done, he makes happen. Doc Blevins, the judge, he's the same way. Rocky Adkins, your majority floor leader. The quality of people you have in elected office on both sides of the aisle in eastern Kentucky, through my experience, is exceptional. So you folks you really are lucky. They've really made the difference as to why Ragent, and we could be in a lot of places. We just picked up a facility out in Arizona, and it was an acquisition. So we're also looking at something in Europe as well. So a lot of places we could be. But we chose this place because of the quality of the people and the relationships that they have fostered from the moment I landed on the ground at Lexington Airport. So a lot going on. Ragent we've provided a wireless network for downtown Moorhead. We donated a network for Tilden Hogg Elementary School. So it's my belief that these partnerships are two ways. It's not merely what can local folks do for Ragent, but what can we do as part of the community? We view ourselves not merely as folks passing through, but folks committed to the area. So I know Jared he's over there and he's like, Bob, you got to stop. So I promise I will stop. I just want to let you know what was going on in Moorhead. Thank those people that have helped us, and we'll continue honoring our side of the bargain. Thank you, everybody.
Hey, we're going to catch up. We're going to free up all the time we lost with the legislative leaders and their comments. You believe that? Is that? All right, so I want to introduce first, they serve on our board. They're ex officio board members of SOAR, and we appreciate their support and their commitment to our priorities and the work that we've been doing. The first person I want to introduce is Speaker of the House, Mr. Greg Stumbo. We appreciate his commitment to SOAR and the region.
Thank you, Jared, Governor Bevin, Congressman Rogers. Thank you all and all of you for being here this morning. Jared made me promise that I would remember the teachings of my Baptist minister, Bill Jaggers. And when I asked him what's the success to public speaking, he said, remember the 5 B's. Be brief, brother, be brief. I want to speak a little bit about the 2016 session, just generally, focusing primarily on the budget. There's good news and there's bad news. It reminded me of a golf story. Congressman Rogers and I have had the occasions through the years to play golf on many occasions. We, Governor, always let him win because we knew someday he'd be chairman of Appropriations and Revenue. But the budget contained good news and it contained bad news. It reminded me of this story. Tommy and Johnny played golf all their lives together until they became old men. And they made a covenant with each other that whoever died, they had to know, was there golf in heaven? And so they made a promise to each other that the first one that would go would come back and share the answer to that question. Well, Tommy passed on first, and about a week after his demise and funeral, Johnny heard in the middle of the night a little tapping in his ear, and he recognized the voice to be Tommy, and he woke up, said, Tommy, is that you? He said, yeah, Johnny, that's me. I came to tell you about what we talked about all those years, about whether there's golf in heaven or not. Johnny said, well, tell me, you got to tell me, is there? He said, the good news is there's golf in heaven, but there's bad news. Johnny said, what's the bad news? Tommy said, you got tea time next Thursday about 8 o'clock. You know, I saw the veterans here a little bit ago, and the good news, I think, for Eastern Kentucky is that we've got people like you all, and like Congressman Rogers, and like Governor Beshear, now like Governor Bevin, who are willing to come here and listen to our problems and talk about them and try to find solutions. We can't solve our problems until we recognize what they are. And I think, to me, that's the most enthusiastic and exciting thing that has happened with the SOAR initiative, that people, leaders all across Kentucky have come together to offer hope to a region which needs hope. You know, we had a pretty, I think, successful budget session as far as we're concerned here in the mountains. We did things like improve the Cole County scholarship monies from $2 million to $7 million so that children in eastern and western Kentucky could use those monies to attend the private colleges, particularly here because we don't have a public university, in their 3rd and 4th years and gain those baccalaureate degrees and use that money to bring their tuition gaps into context with each other's so they would lower the cost of their tuition at Pikeville by utilizing these monies to what it would have been had they gone to Moorhead or Eastern or one of those colleges. We were fortunate to have a return of the severance tax in the budget for the first time ever in Kentucky's history. The two houses agreed and statutorily passed a bill which would have guaranteed legally and put into our statutes that the severance taxes would be returned to the coal-producing counties. Unfortunately, the governor saw fit, because the bill contained other things, to be fair as well, to veto that bill. But in the budget, Senator Stivers and I, leading the conference committees, were able to compute a formula, Governor Patton, which starts that return and brings quite a bit of money back to the coal counties who have been devastated economically as far as their abilities to grant and deliver basic services. The governor did not veto that part of the budget bill, even though he had the opportunity. And Governor, I thank you for that. And the counties, I know, thank you for that. We were also able, in that very same bill, with the economic development, with the coal service money, to create this economic development incentive fund, which we hope will be the start of what those who were at the first SOAR meeting will remember, the Iron Range plan that was laid out to us. We hope that this will be the initiative, this will be the seed money that will start us down that road for recovery. But Eastern Kentucky lacks. We lack in the basic things that make us competitive, and it's wonderful that we're getting all of this technology, but we don't have an interstate. People ask me all the time, what's the problem? Well, we don't have a navigable river, we don't have an east-west interstate, and we don't have a public four-year college. Now, God gave us a lot here in the mountains to be thankful for, so I don't blame him for not giving us a navigable river, except at Ashland. But I do blame the federal government for not giving us an interstate to access the most remote part of America, one of the most remote parts of America left where an interstate highway doesn't run. And so we've been working on a plan, and I hope that Governor Bevin will recognize the significance of that, to bring an interstate from Beckley to Prestonsburg and on down to London, Kentucky. Ladies and gentlemen, we can't get our goods to the east except by rail, which is almost cost prohibitive, or air, which is equally cost prohibitive. That road is vital to our economy. West Virginia passed legislation which would establish the Bi-State Commission. That's the first step. Governor Bevin can accomplish that by executive order if he chooses to do so. And that commission would be appointed by the governors of both states, and they would formulate a plan that would be brought back to the legislature and to Congress, and see what avenues of funding could then be brought to bear to make that dream a reality. The four-year college situation, in my judgment, even though Governor Patton, the scholarship monies help, we still have that challenge before us. Eastern Kentucky needs a four-year public college. And I don't say that as an affront to Moorhead, I don't say that as an affront to Eastern, but the geography will tell you that it's just basically not fair when a child is born in Phelps, Kentucky, and it takes him or her over 3 or 3.5 hours to drive to the opportunity of a public four-year college. When a child is born in Winchester, Kentucky, within an hour they can attend 3 public four-year colleges of their choice. They can take their choice. That is inherently unfair. And much like the dynamics of a meeting like this, if you look and study what happens in the communities across Kentucky, in Murray, in Bowling Green, in Richmond, in Moorhead, what happens in those communities is all the dynamics that we look to, all the metrics increase. Per capita earning increases. Educational attainment values increase. Everything in the economy increases because these colleges are just like little economic engines, and Pikeville does a wonderful job, and so does our community college system. But unfortunately, because of the difference that's required from a private college tuition to a public college tuition, it sometimes becomes unaffordable. That was the goal of the Cole County scholarships, to bring those two at least closer in line. But ladies and gentlemen, I believe that the promise of the mountains can be obtained, because I believe that we are in the exact time, at the right place, given the opportunities that we have in Washington with our leadership there, given the opportunities and the momentum and the enthusiasm that all of you have brought here to solve those problems, to start setting in motion a plan that will diversify our economy while protecting our coal industry as best that we possibly can. Those should be our goals, to protect what we have, to build on what we have, but to be innovative and recognize that the future belongs to those who will think. The future belongs to those who will dream. The future belongs to those like you who will sit and listen and try to figure out a way to solve problems. And for that, to each and every one of you, from Governor Bevin and Congressman Rogers to everybody here today, I want to say as an Eastern Kentuckian, thank you and God bless you.
Thank you, Speaker Stumbo. Our next speaker is President of the Kentucky State Senate, President Robert Stivers. We appreciate his support and commitment to our communities.
Thank you, Thank you, Jared, and I appreciate everyone coming out. Jared wants us to get back on time, so I'm going to try to be brief. I didn't go to the same church as Speaker Stumbo, but I'll try to keep that in mind. First of all, I want to kind of set out a few things that I want to talk about. And I want to talk about my children. Everybody says, well, why do you want to talk about your children? Well, first of all, the one thing I want to say is my son's running in a camp this year called Maximum Velocity. And along with Maximum Velocity, you have to start slow and you get up to speed. And what we have seen here is that we've started, and there's nothing going to change quickly. And as we come out of the gates, we have to eventually reach that point of maximum velocity. So I use that analogy to talk about this. We're here to talk about what some people will say is Renaissance. I'm telling you, I think it's Renaissance and revolution both. A Renaissance of an area that has had problems, but it is also, and coming back to a day and age where we have people coming here and creating jobs. But I will tell you, it is also revolution. Because what I heard earlier was Representative Combs talk about how she worked with Max Wise, a House Democrat with a Senate Republican. You heard the speaker talk about how we worked together on several things in conference committee to come up with more scholarship monies, more monies for the investment. And part of getting up to that maximum velocity, we took one of the items that came from the initial discussions in creating that endowment fund that Governor Bevin talked about, that we will perpetuate that, working together, not as Republicans and Democrats, but as Eastern Kentuckians and with the leadership of Governor Bevin and Governor Rogers to create a renaissance, but also a political revolution where people are no longer worried about party affiliation or county lines. To that extent, I want to say this. You know, I've seen Governor Bevin bring in a lot of different people into his administration. I talked to some people as they work on, and you'll hear a little bit about a project back in Bell County that's coming to fruition. You know, I want to thank my wife, who is as a deputy secretary of one of the cabinets working in tourism. And that goes back to what Representative Combs was talking about and how they put together the P3 legislation. So I'd walk into the Capitol in the morning and hear it from her. And I'd walk into my house at night and hear it from my wife because she is in parks and tourism. And I see they giving each other high fives. They call my wife and myself the Beauty and the Beast combination in Frankfurt. I'm the beauty. A lot of people in the front row are really laughing about that one. But it was a different dynamic, and truly over the last 3 or 4 years, it's been a different age because we have tried to come together to figure these things out. We have done things for our children. I know Rocky Atkins is here. If we can set aside party differences and chamber differences to create a Gatton school, which my daughter went to, who now tells me about injecting nanomolecules to try to figure out cures for cancer. With Representative Atkins and myself, we created there's Rocky right in front of me, we created the Craft Academy so children east of I-75 had that opportunity to go to a school, a dual-credited school when they're 16 and 17 years old to get the math and science background that they've never had access to. And now, are we not going to have just one of the nationally recognized high schools in the nation in Bowling Green? It's going to be in our backyard in Moorhead, Kentucky. That's why I tell you this is all about renaissance and revolution, because we're dealing differently with our problems by changing the politics of this area, and much of that has to be attributed to our Congressman Rogers, that has brought that type of attitude to Eastern Kentucky. Lastly, I want to say this. You know, Jared talked about excitement, the governor talked about passion, all the different things that we have to have. Well, I am a multi-generational family. I am from a multi-generational family from Eastern Kentucky. I go back to the second governor. Governor Garrett was my grandmother's grandfather. They moved to Eastern Kentucky to watch over the mineral and salt interests in Clay County. Garrett, Kentucky, a little community you drive through. You know, I've had 4 children, all raised in Clay County. They're at various universities and things of that nature, but they don't have a real likelihood of coming back to Eastern Kentucky. So what do we have to do? We have to create that environment that the political lines of counties, the political lines of parties do not exist. Because it is in our children's best interest and the future of this region that we move forward and go in that direction. The commitment that I know each and every legislator, Republican or Democrat, that the governor has and the congressman has, is to make a better and brighter future, a renaissance through a different type of politics, a revolution in politics. And why do I tell you that is so much of so importance? Tomorrow, I will be sitting at the hospital watching my first grandchild be born in Eastern Kentucky, not driving to UK, not driving to another place outside the region, but a 10th generation Stivers being born to Eastern Kentucky. And that's why we all, for our children and our grandchildren, have to create the renaissance and have the political revolution. And I welcome you all to both of those here today.
We are now jumping into our innovation showcase. You're going to hear from BitSource and a lot of other vendors that are set up here. We're going to have it kicked off by Secretary of State. No, my goodness. Take me off the stage. State Treasurer Allison Ball. Wrong title. I left my notes down there. State Treasurer Allison Ball. Also worked with her at the Young Professionals of East Kentucky. So she's a young professional from this region, from Prestonsburg originally. Honored to have her talk about what's coming up next year. So thank you, Allison.
Thank you, Jared. Excellent. Well, it is wonderful to be here today because I am an Eastern Kentuckian. So SOAR is an initiative that I believe in, and I know all of you believe in it too. I'm from Floyd County, grew up in Prestonsburg. My family has been there for 9 generations. So I'm deeply rooted in those mountains, deeply rooted like a lot of you. I see my neighbor, Kathy Allen, over there. So I believe in this just like you believe in it. And I want to tell you, when I graduated from college, I went to the University of Kentucky College of Law, and I got my first job in Lexington. I was clerking for a judge, and I remember I wanted to come home. I really wanted to come home, and I was looking for opportunities to come back. And a job opened up here in Pikeville about 6 months into my clerkship. And I remember talking to my judge and saying, Judge, can you let me out early? There's an opportunity back home. I really want to come home. And I remember the judge taking me aside, and this is no offense to him, but I remember him taking me aside and saying, Allison, you got a lot of opportunities, you got a lot of talent. I don't think you should go back to the mountains. He actually told me that. And I said, Judge, I want to. This is my home. I love it. I believe in it. I feel like I was praying about it at that time. I felt like God was leading me to come back home. I said, I want to come back home. So he let me out of his clerkship early. I got back. I moved back to the mountains. And when I got home, it was so great to be here because I know all of you know this. We have all the ingredients for success right here in Eastern Kentucky. We've got it all. And so while I came back, I became a prosecutor. Then I started practicing with a buddy of mine from law school who also wanted to come home. We opened a bankruptcy practice right here in Pikeville. And I remember getting involved with the Young Professionals of Eastern Kentucky, talking to other young people who wanted to be here. They could see the vision. They could see that there was a future here. So I got on the board of the Young Professionals of Eastern Kentucky. I served with Jared and later became chair. I actually still serve, even though I'm state treasurer and I'm in Frankfort, I still serve on that board because I believe that we have the ingredients for success here. And I want to tell you a very quick story that I think exemplifies what we have here. It's about somebody in my hometown, an older lady named Lula Lafferty, who became a fixture. I know Kathy will probably remember her. She became a fixture in Floyd County and when I was growing up. She passed away when I was a teenager. And I remember hearing stories about her growing up. And one of the stories was that her husband had been the first person to get a master's degree in education in Floyd County. And he'd been a coal miner and wanted to make something of himself, so he went back to school as an adult, got a master's degree, wanted wanted to be a teacher, and he was beginning to teach school, married to Lula Lafferty, had 5 kids, and about that point in time, when he was about 50, he passed away, leaving her in her 40s with no high school degree, obviously no college degree, no training in education, no training in skills, nothing really other than 5 kids at home, and she had to figure out what she was going to do to take care of those kids. And I love this story because this is about 1940s, so we had the apparatus of social services to help her, but she wanted to make something of herself. So she applied to be the postmistress of Floyd County. Now the interesting thing about that is she applied for it, and I think they must have asked her, do you have a driver's license? Because at that point in time, you had to be able to drive to do that. And I'm told that she probably lied about it because she did not have a driver's license. So she was appointed postmistress of Floyd County, no driver's license, didn't tell anybody she didn't have a driver's license, got the job, and she used part of her income to hire out high school students to drive her around. And she did this for decades. Used that as a career, raised her children. Her children all became successful. One was a judge executive in Floyd County. Another one started a pipeline business where his brother then was like his right-hand man. All of her children ended up doing successful things. And I love that story because I think that shows what we are as Eastern Kentuckians. You know, we're independent. We can take care of ourselves. We know what it means to work hard. We love our family. We understand our community. We value our community. All those things are the ingredients for success. I love that story because I think that exemplifies all those principles. I also love it because it was my great-grandmother, and I just think that just shows us what we have here as a heritage in these mountains in Eastern Kentucky. So we've got the ingredients. We need something else, and that's why we're here today. This is the Innovation Summit, right? The Innovation Summit. Well, what is that next thing to pull all those ingredients together? We need opportunities, we need innovation, we need ideas. So for the next little bit, I know everyone's excited about lunch and everyone's been here a long time, but for the next little bit, this is the nuts and bolts of what we're here for today. You're going to hear several people present, and I've actually met some of these folks because some of them have come to the Treasury to talk to me about their ideas. And you're going to hear nuts and bolts of ideas that people have to turn around Eastern Kentucky, to give us opportunities, to give us ideas. So listen up, pay attention. There are things that can impact your life. There are things that you can get involved in, things you can support. So here we are. I know we've got several people, and I'm going to turn it over to Jared or they may even just start off right off the bat. But here we are. Listen up, nuts and bolts. This is what we're here for today. The different presenters who are giving us all these ideas and opportunities. And thank you very much for being here. Here you go, Jared.
Thank you, Allison. We're going to jump into our first one. We're going to talk about a school health collaborative. These are 5 minutes each. At 4 minutes, you'll see me come to the top of these stairs and stand, so they'll know when they've got a minute left. The first one is Dr. Omar talking about the UK SOAR Health Initiative.
Thank you. Well, it's not morning anymore, but I'll say good morning anyhow. What I want to talk about is everybody talked about resources and what we can do and cannot do, and industry, and this is all good. But in my book, the one single most important resource is our people. And the people of Eastern Kentucky are great people. It's just they were dealt a bad hand sometime in the past. And if we want to improve the future, we can't just rely on improving diabetes and asthma in the adults. We need to start early. If we don't have productive young people, we will not have productive adults. And so we talked with a lot of people from Eastern Kentucky, school leaders and others, and we still understand that a lot of our kids are going through problems, be it drug use, being depression, suicide, violence, human trafficking, you name it. There are many problems that go through. Roughly about 1 in 3 kids have an issue. And if we don't address these issues, they will become a problem in adulthood, and that's why our workforce stays lower and less productive. So it's an economic problem, it's a public health problem, and it is preventable. It can be solved without spending too much money. It's actually a lot cheaper to do it the early way. Teenagers are going through a lot of changes, just by default. They're growing up. There are physical changes, sexual changes, moral changes, religious and beliefs changes. And all this is going on with them while their brain is still not completely developed. Their brain's not going to develop until age 24. Now you got the answer why rental car companies don't rent cars to under 25, because they understand what teens are going through. So because of that, most of the problems that teens have are not like adults. Teens don't die from diseases. So when we keep talking about diseases, that's not what kills our teens. What kills our teens, if you can look, is mainly accidents, homicides, suicides, eating disorders, teen pregnancies. All those things account for almost 90% of the death rate in teens, and the same with disease. So the research over the last 20 years or 30 years, especially the adolescent health study, had shown that for teenagers to do well, they don't need that much. If you consider the teen in the middle here, they need one or more adults that care about this kid that they can talk about. They need some place to meet with those adults and interact with them. And they need a useful thing to do. If they don't have a useful thing to do, they will be in trouble. There is a very old Arabic saying by a poet that says, if you are young, if you have a lot of money and you have free time, you're in trouble. You'll not get anything done. So the bottom line is, this is what we need. And we call it positive youth development, building the teens, improving the life of teens. And I'll give you a simple example. I'll explain why that works. We keep talking about disease, but look at teens. In Kentucky and in the US and across the board, suicide is the second leading cause of death across the board. In Kentucky, every year, suicide kills 46 to 47 kids. All those diseases listed there kill only 6, but the state spends over $700 on those and 1 penny on suicide. That doesn't make any sense, does it? Now, I don't know if you can see it well here or not, but the amount of money spent on just admissions for attempted suicides, over $12 million from state money every year. And it's not making any difference. So if we approach these things as to prevent problems, where we talk with kids in schools and screen them all the time, then we get a lot better results. I'm going to show you one of the counties in SOAR counties that we are working with. Every teen outcome is improved. If you look at suicide, that's the only county in the state doing well. And the other thing is, for the first time in history, we dropped Kentucky below national average in suicide. Teen pregnancy, we're getting there also. So we have lots of partners in the state, in the area that we are working with. This what would happen, improve for the schools, for the community, and for the health-based as a whole. We have schools who are ready to start. It's just we need to work with them. It's basically we interview all kids in the school. We set up support system for them. We work with them all year long. So in Lincoln County that we started in 2007 was one of the worst counties in the state. Now it's one of the best counties in the state in all teen outcomes at a cost of less than 1 ER visit from these kids. So these are the partners that are willing to work with us. And I'll leave you with a quote from FDR, our 32nd president, who figured that long time ago. We cannot build the future for our teens, but we can build our teens for the future. Thank you.
Thank you. Thank you, Dr. Omar. Next one, we are looking at regional food collaborations and how do we build food systems in Eastern Kentucky. Alita Botts has done a great job heading that up and bringing partners together. Ms. Alita Botts.
Thank you. Well, as the previous speaker was talking about health and health outcomes, it occurred to me that at the beginning of any discussion about health is about the type of food that we eat. And the type of food that we eat is related to the agriculture that we practice in this region. I work for the Kentucky Center for Agriculture and Rural Development. But I grew up on a farm in Betty Gap Ridge in Menifee County. And I can tell you a few things as a result of that experience. One, it's May, it's springtime, and producers are optimistic around that time, all right? It's a new season. It's a new season for growth. And they're also prepared for whatever's going to come at them. The final thing that we know about farmers on a pretty 80-degree day in May is that they don't have a lot of time to talk. So I'll keep my remarks brief. The first thing I want to note is the phone number up there, 606-765-0915. Anyone who wants to contact us about our work with regional food systems, that's the number to Marissa Christie, our project director for the region. She's here in the audience, so please don't dial it right now. She's also out by the displays, but we do want you to reach out to us. We're interested in regional food systems because we've been working with producers since 2001 across the state to help them with business development, market planning, feasibility work, help them and their businesses. As part of that work, we became engaged in the SOAR project, and we've had a lot of discussions with other people who were truly committed to agriculture and food system development in the region. Through those discussions with entities like Community Farm Alliance, the University of Kentucky College of Agriculture, Kentucky Beef Network, Kentucky Hort Council, and the Kentucky Department of Agriculture, we came together to put together a project that focused our resources on agribusiness development in Eastern Kentucky. A lot of people don't realize that in the 21 county region of the southeast corner, there's 5,000 farms. That's a lot of people producing agricultural products in the region. Now, you see a lot of different pieces of that picture up there that's not farming. We have amazing assets in this region that are going underutilized. We have meat processors that are capable of taking that beef we're producing on pastures and reclaimed mine land and getting it to urban areas so that people can direct market their beef in ways that they've never been able to before. We've got the Jackson County Food Center, where food entrepreneurs can take their product and produce products for Kroger and other retailers. We have enormous opportunity in this region, and through bringing together these partners, we hope to take advantage of that opportunity. KCAR's been doing this work statewide for a long time, thanks to the generous support of the Kentucky Agricultural Development Board and the U.S. Department of Agriculture. What we're putting together now brings forward resources from the Appalachian Regional Commission, Economic Development Administration, toward the goals that we have to take the agriculture production that's being conducted now in the region, expand it to new markets, and help the local food system develop. What we see is that if we plant seeds, they will grow, but they're going to need care and cultivation. And part of what we're here for is to provide that care, working with the partners that you see listed to help these farmers grow, to help these businesses grow, in the hopes that by growing that local food dollar and keeping more of that local food dollar here in the region, we're going to have greater economic growth from those 5,000 farms. Thank you.
Thank you, Alita. Our next program, community-driven innovation, exciting things going on. We have Eric Mills with Dream Martin County.
All right, who wants some pulled pork barbecue? Let's all wake up now, come on. This is the most important part of the day, and I'm excited to share with you a little bit about what we're doing in Martin County. My name's Eric Mills, as he said, and I'm an attorney in Inez, and I'm privileged to be with my co-pastor friend, with my pastor friend, co-chair of the Dream Martin County Coalition. You know, it's pretty interesting, and you know things are going to happen when you combine a pastor and an attorney. So there's some pretty creative things going on in Martin County. We're excited to share that with you. You know, way back in April, if we can think about the sound of Marine One, you know, that big chopping sound of a helicopter landing in the air. 1964, President Lyndon Johnson set foot in Inez, Kentucky, and he did so to declare an unconditional war on poverty. He stepped off that helicopter, and the whole presidential entourage went down to Tom Fletcher's front porch. Many of you probably seen that picture, right? Of Lyndon Johnson hunkered down on a porch with these on a dilapidated old house with these children in the background and Tom Fletcher there beside him, declaring this is not going to happen in America anymore. Well, I'm here to tell you 52 years later, that house stands today, and the same people in that picture, their relatives live in that house. That is the challenge that we're facing in Appalachia and in Martin County. Intergenerational poverty. It is more than a government dollar bill can fix. It is a spiritual poverty. It is one that requires a support from a maker above all of us, and it requires that we act on our faith to make a difference. We're not going to stand by and allow this poverty, allow this spiritual deficit of this culture of dependence to control our destiny and our future anymore. And so that's why, as we began to come up on the 50th anniversary of Dream Martin County, or of the 50th anniversary of Lyndon Johnson's visit, we began in prayerful insight to say, God, what would you have us do? What would you have us do? Because this problem is greater than any of us can solve. And so we began prayerful consideration, and the Martin County Ministerial Alliance was formed in the fall of 2013. Then, in March 2014, we started a drug march where we declared to all the dope dealers, we're taking back our community from you, we own it, and we define our future, and that's what we're going to spend our time and effort doing. As members of the church and the faith community, as members in the government and the leadership community, and members of the educational community coming together. And 1,500 people came to that drug march and marched over a mile down Martin County to send a message that was unequivocal. This is our community, and it belongs to us. Then a month later, in April 2014, 2,500 people gathered in the parking lot of the Roy Collier Community Center in Inez, where we acknowledged the war on poverty and celebrated the 50th anniversary of the government's best intentions. But we also then that same day declared our own war on poverty, one that will be led by faith, an inspired coalition that was coming together for the purpose of restoring hope in our future, to address the spiritual poverty that Tom Fletcher's family still suffers from today. You know, I don't cast judgment on the Fletcher family, they're good people. But I cast judgment on a government set of programs that just ignored the real problem. And so that's what Dream Martin County is all about. We started that effort, as I said, in early 2014, those two big events, the drug rally, then the Dream Martin County War on Poverty, the new War on Poverty. Then in August of 2014, we had a Learn, Dream, Succeed Back to School Bash, where we honored our students in Martin County. We gathered over 1,500 people, 900 of which were students, at that same community center to recognize and celebrate what it means to dream big dreams. Each one of those students signed a pledge to do their best, to always be on time at school, and to study hard, and to dream big dreams. And then, in November, we achieved our Work Ready in Progress designation in November of 2014. These moments, moment after moment after moment, were building momentum. But the enemy attacked us in our efforts, and even some of our families. Change was not coming fast enough to make up for all those jobs that were lost by the shutdown of Martin County Coal, for example, and the many other coal-related jobs in our community. So yet again, we turned to faith. We gathered in prayer, and as community leaders and young professionals, we took forward the idea of unity. And in November of 2015, we organized a unity revival where churches of all different faiths, believe this now, you know how Eastern Kentucky churches are. Churches of all different faiths came together and worshiped together and called upon God to restore the unity in Martin County in our efforts to rejuvenate all that we knew He wanted for us according to His plan. His plan is to prosper us, not to harm us, to give us a hope and a future. And this unity rally then spawned off a Women Serving Christ ministry that worked across the region and in Martin County. And then in January 2016, our churches came together to sponsor love lunches. In the last week of the month, when the checks are running out, people are hungry, and we need to show them the love that they deserve. We need to help them have a hope, because we know their hope doesn't come from a government check or a government dollar. It comes from something greater. And that was a love that they're being shown now every last Saturday of the month through love lunches. About that time, the Nazarene Global Compassionate Ministries program sponsored a grant and recognized our work and expanded our capacity with a $35,000 grant to hire some consultants to help us. And in that amount of time, we then began working toward Unity Weekend, which we celebrated just this last April with a family kickoff night, celebrating the family and the work of our children in the community. And that Unity Weekend Saturday morning was a strategic planning breakfast where we had over 100 people, not just people, but small business owners, local professionals, community leaders, pastors gathered around to develop a strategic plan. Congressman Rogers, we developed our plan and now we're working our plan. And I'm excited to share that with you in the moment we have left. We're reigniting the maker culture, the pioneering spirit that settled this nation and settled this rugged terrain. We are awakening the makers. And Commissioner Donahue and others, thanks to some grant funding, we're building a makerspace in Inez. We're allowing people to explore and awaken the pioneering spirit of our forefathers that was left in our DNA. Our kids today, in fact, in Inez, are at a coding camp being held at this makerspace, learning how to write code. They're also going to learn about aerospace, about how to build robotics and 3D printing, dreamdiscovery.org. We're having some very innovative summer camps for our kids to expose them. I'm excited as well to share with you plans for the great Appalachian Maker Fair as well in Inez. So all you people from Pikeville, you're going to have to drive to Inez, all right? That's coming in the fall. We'll share more with you on that soon. And to expand local capacity, because we can't do it all ourselves, we built the Dream Institute for Leadership and Service Learning, where we are bringing people from the outside in. We hear about all these missionaries and people that want to help. We're coming to make that a possibility, to coordinate that effort with our plan so they can help our plan. I always tell people, I love people that put up vinyl siding. We need it. But we've got a lot greater needs in our community too. And we're organizing all those that want to contribute in a way where they have the greatest impact. We're establishing the Dream Community Foundation to organize resources. And in closing, I guess I'm already closed. We have a vision, and I would invite each of you to come over to our booth and learn more about the details and watch some of the videos of the experiences we have in Martin County. When God and faith inspire your work, you know no bounds. Your limit is only His. And so I would challenge each of you, many of you who are no doubt people of faith, to live out your faith, to live it out in support of this community and support of this region, because this, now more than ever, is going to be the way that we overcome the challenges we face. Thank you.
We've got a dead mic. We've got David Ledford with the Appalachian Wildlife Foundation looking at an Appalachian Wildlife Center on a reclaimed mountaintop site. So, David.
Thank you, Jared. All right, how do we work here? That's already on the wrong slide. There we go. Thank you for this opportunity to speak. I'm the CEO of the Appalachian Wildlife Foundation, and we're a 501c3 nonprofit charitable organization based in Corbin, Kentucky. We're here to talk about innovation and new ideas to launch a new economic future for Kentucky's Appalachian region. What if somebody said they were going to build a business in southeast Kentucky in the heart of the coal fields on a big mountaintop removal coal mine that was going to create over $124 million in regional economic impact each year, give out $200,000 in college scholarships each year, create over 2,000 jobs, and was going to research, develop, and promote sustainable uses of old reclaimed coal mines? It almost sounds too good to be true. Well, it is true, and it's what I'm here to talk about. We are developing the Appalachian Wildlife Center, and it's a big, bold, audacious project that will have immediate and enormous impacts on the region's economy and job creation potential. It's a completely new direction. The center will be a wildlife conservation education facility reaching 100,000 kids a year and a major tourist attraction. As a tourist attraction, the Wildlife Center will attract over 630,000 visitors in its 5th year of operations. Those visitors will spend over $124 million in the region in 1 year. That amount of spending over a 5-year period will lead to the creation of over 2,000 jobs. In less than 9 years, the regional economic impact from the Wildlife Center will exceed $1 billion, with a B. The center will be located in Bell County, Kentucky, where Kentucky, Tennessee, and Virginia all come together. So the economic impact is actually going to hit 3 states. 3 states are going to benefit from this. With a 45,000 square foot building and situated on a 12,000 acre, 19 square mile property, the visitor experience at the Wildlife Center will be a combination of the Smithsonian Museum of Natural History, an Appalachians Artisans Market, Cades Cove and the Great Smoky Mountains National Park, or Yellowstone National Park, where you can drive and hike through beautiful landscapes and see a lot of wildlife. Kentucky has the largest elk herd east of the Rocky Mountains. And anywhere elk are highlighted as a tourist attraction, people come and they spend money. Elk will be the marquee species at the Wildlife Center, but we also have deer, black bears, and over 240 species of birds can be seen on site. So how do we know it's going to be successful? How do we know that we're going to do this? We know because it's been done before. Our model is the Elk Country Visitor Center in tiny Benezet, Pennsylvania. And I say tiny because Benezet has 2 stop signs. It makes Prestonsburg, Hazard, and Pineville look like some really big towns. They opened in 2010. And the slides aren't working. And they were forecasted and hoping to host 160,000 visitors by the year 2016. In 2013, they hosted 360,000 visitors. They broke the 420,000 visitor mark in 2014, even though they're closed 3 months out of the year. The main reason for their visitor numbers is that they have elk. Elk are the charismatic megafauna that attracts all those big visitors. Elk are big, pretty animals that acclimate to people rather quickly and are perfect for tourism. The Appalachian Wildlife Center will exceed their numbers because we have a much better location, we're going to have much larger facilities, we're going to have a broader variety of activities, and we're going to be open year-round. Our location is within 1 hour of 3 interstates. It's within a day's drive of 63 million people, and the site is less than 100 miles from the Golden Triangle of the Great Smoky Mountains National Park, Gatlinburg, Pigeon Forge, and Sevierville. They get 15 million of people a year that go to that Golden Triangle. We're going to target that group very aggressively, and we just need a small percentage of those people to come to Bell County to blow the doors off. About 7,500 acres of the Wildlife Center is forest, and about 4,500 acres of the 19 square mile property is grassland habitat that was created by reclaiming coal mines. That diversity of habitat is why wildlife is so abundant there, and it was on this very site where mountaintop removal was actually perfected as a coal mining technique in the 1970s and 80s. That innovation transformed the coal economy of East Kentucky and of Central Appalachia. It's somewhat poetic that the next transformative development for the region will happen on the same property. In closing, the Wildlife Center is a big, bold, audacious project that the region needs to transform itself into a completely new direction. We have beautiful landscapes, abundant wildlife, and the time is right to capitalize on these assets. Please come see our display table. It's up in this corner. Underneath the scoreboard to the left, we're up there. We've got brochures. Have board members up there. Glad to answer any questions you may have. Thank you.
Well, it's just, I don't know, it was just like a vacation home.
we're going out of the dock, and we're hearing somebody going, Dewey, Dewey. Mark goes like this. He said, well, I guess we won't need this. A Dirty Harry 44 comes out of the back, okay? Listen.
Hey, some dude named Dewey Ray come in here with somebody packing a huge pistol.
We better get out of here.
Well,
that's all you had to do to get on it.
So you gonna shoot like inside the house?
I don't know. We're just kind of
dark on the inside.
We're just kind of gonna look around and.
I got a rope.
Good seeing you, man.
Give your mom a hug for me.
I will. And you give your mom a hug.
But the main thing was, when I was growing up, was the mines, education, and then private businesses, grocery stores here and there, or you know, a repair shop here and there. And
well, this is my great grandmother's house. It's where I spent a lot of my childhood. This place, like a lot of places in the area, are just kind of dwindling away to nothing. There's not much here for work. The mines are closed down, and people are just trying to get by, or they leave if they can't. And I think this song it tells a story about my family and the people that made it special for me, but also about the area in general. You know, this is where the inspiration came from. This is where the music came from, is this place. Seeing people like play it and put it together and perform it, even if it's in the living room, just remembering that, it's kind of changed my outlook on music in general. You can have powerful performances and powerful musical like moments anywhere. There's grit here, and because you have to have it to still be here. My grandparents and great aunts and uncles and my dad and me are products of this area, and you know, Dad said it breaks his heart every time he comes up here, and you know, it breaks mine too.
You ready, buddy?
Yeah. 1, 2, 3, 4. Will Granny move the family piano from the boarding house up the road? From the New York Company Rudolph with 2 fresh bullet holes, where Mary learned to sing on her hymnals, Virginia dancer jigs. Shorty, he'd tune up the banjo while Julie fed the kid. Yeah, it's a long way to Wheelwright, with the sleep running through my eyes. Her chariot awaits to the sweet by and by. All along the Drawhouse line has left most folks behind. It's a long way to Wheelwright. I hope we make it there tonight. Well, Daddy, he sure loved the junction, always proud as he could be, living in his Creekwater mansion right next to Doc Osborne's Sundries.
A boomtown as a young un and a ghost town as a man. Though there ain't much left for packing, son, yeah, we've taken all we can. Yeah, it's a long way to Wheelwright, with a sleep running through my eyes. Her chariot awaits to the sweet by and by. All along the draw hus line has left most folks behind. Yeah, it's a long way to Wheelwright. I hope we make it there tonight. Well, that time was my pleasure, and those days were made of gold. I spent all of my time spent at the bluegrass picking show. It's a long way to Wheelwright, with a sleep running through my eyes. Her chariot awaits to the sweet by and by. All along the draw hus line has left most folks behind. Yeah, it's a long way to Wheelwright. I hope we make it there tonight. I hope we make it there tonight.
A big hand for Nick Jamerson. You're familiar with Sunday Best? He is one of the duos there. 6 years ago, I was selling guitars in a guitar store, and there was a guy kept walking in. He was playing at Champs, a little bar, and his name was Nick Jamerson. I was selling guitars, he was playing music. And we're both working the same angle. You see, he's using his talent, his innovation, talking about our roots and our heritage and who we are. And I appreciate his support and commitment to be here today and share a song he wrote about his hometown in Floyd County, Kentucky. Another big hand for Nick. Our next speaker is SOAR STEM. It's an initiative to move STEM education into K-12 education and support teacher leaders. It's Brad Thomas with East Kentucky Power Cooperative.
Wow. Let's throw him up after somebody with real talent is up here talking. Yeah, that's not really good, but I've got something good to tell you today, and it starts right here. Did you know right now in the United States, there's 1.2 million unfilled STEM-based jobs? By 2020, the Bureau of Labor Statistics says that there's going to be an additional million jobs added to that, so 2.2 million jobs in STEM-based fields that will be unfilled. So let's come up with a solution. You know, I'm not a greedy person, but I tell you, I want about 100,000 of those jobs, and I want them right here in Eastern Kentucky. So how are we going to do that? We have to create the world's largest STEM-based workforce. Sounds like a big concept, right? Well, let me tell you, it's already underway. And let me show you what I mean by that. Right now, we're building the foundation of teachers. Congressman Rogers kicked this off about a year ago, and he talked about it then that teachers are the most important piece because you've got to build the foundation of teachers before you can do anything else. We are starting with 64 teachers in 24 counties, and we raised $3 million to help these teachers over a 3-year period obtain 3 things. The first one's their national board certification. That's a national recognition for their abilities as a teacher. There's also a master's degree and a rank change. We're putting dollars in their pockets to help them to move forward in their educational career. And then lastly, they're getting Project Lead the Way certification. Now let me ask you a quick question. How many of you all know what Project Lead the Way is? Good, I'm glad to see those hands raised, because if you don't know, stay tuned, because you're gonna see it roll out through Eastern Kentucky. That is exactly what phase 2 is. We want to create Project Lead the Way pathways to help create this largest STEM-based workforce in the country. How many times do we have an opportunity to set Eastern Kentucky ahead of everyone else in the country? Right now's the time, and how do we do it? We bring Project Lead the Way to 177 SOAR schools. We've already raised $2 million to help this begin. And when we start talking about it, we're implementing it in the grade schools, the elementary schools, the middle schools, and the high schools. And as we talk about this, I think it's very important to understand that this is the future opportunities for our children. We want to build it beginning in kindergarten, because that's when we can influence their future decisions and career opportunities. As we look at this, we're starting with Project Lead the Way launch, with Gateway, and then 3 pathways. The first one's biomedical science. Makes a good push to leverage the resources that are in the Pikeville region. We also are looking at computer science, and you're going to hear Encore Gopal and some of our friends with EKSEP talking about an initiative that they have underway that we have been working with them. We're creating an ecosystem that's going to create new jobs and new opportunities for Eastern Kentucky. And then lastly, we're going to be building upon engineering. Why is this important? It's because we have talked to industries looking to expand throughout the world, and they keep saying the number one reason that they're struggling to find opportunities is workforce. We are going to create the biggest STEM-based workforce in the country that's going to help fill those opportunities for Kentucky. When we also talk about this, we want to have those industries be a part of what we're trying to do. We want to have the companies be part of the curriculum to help us give real case scenarios of what should be done and help build upon the students' educational environment. So as you've heard, we're doing phase 1, we're doing phase 2, and they are underway right now. And when we talk about the students that have been involved, we've already influenced about 18,000 students and 190 teachers. That's a good start, but we've got a bigger vision. We want to influence 100,000 students in that 177 school districts. We want to make sure that we have 3,000 teachers ready for the curriculum to take Eastern Kentucky to that next step. Thank you today, and we hope that you will join us and help build the largest STEM-based workforce in Eastern Kentucky. Thank you.
Our next innovation is with Kentucky Valley Education Cooperative, KVEC. We've got Executive Director Jeff Hawkins going to preview and introduce a video they've got showcasing things that are going on in the classrooms in Eastern Kentucky that they have driven. We really appreciate Jeff Hawkins.
Thank you. Kentucky Valley Educational Cooperative began in 1969, and we have 19 of the finest school districts in the United States within our geographic footprint. We begin in the north in Johnson County, go down to Harlan and Bell, and out west to Wolfley and Owsley. And we do support work. We focus on teaching, leadership, and learning at our cooperative. We've been very blessed in the last 10 or 12 years. We've grown from 8 districts to 19. We have won 2 United States Department of Education awards, Investing in Innovation and Race to the Top for districts. The Race to the Top grant is what propelled us to create the Appalachian Renaissance Initiative, and we're very proud that we do have some of the finest kids and the finest educators in the country. We don't think that there is a challenge that our talented kids, engaged community members, and committed teachers cannot solve. Last week, we were notified that we had received a Bill and Melinda Gates Foundation Award to continue the work that we do, and we're happy to have them as collaborators in this fine work. I'm going to show you a video of some of the work that's taken place in classrooms across our region. This is a snapshot and only some of the hundreds of innovations that occur every day. Thank you.